Welcome to No Filter Doctor, where we cut through the health hype and dig into what's real, what works, and what's backed by evidence. I'm Dr. AK. Let's get into it. Hey everybody, thanks so much for joining me. I'm going to use this first podcast to tell you who I am and what this podcast is about. And for those of you who are like me and you are in the get to the point category, I'm going to start with the short version. Then I'm going to go into the longer version for those of you who want the whole story. Here's the short version. My name is Dr. Annahieta Kalantari. I'm a double board certified emergency medicine and lifestyle medicine physician, and I happen to also have a master's degree in adult education and lifelong learning. That leads me to, what is this podcast about? And the bottom line is, it's about educating patients. There's a lot of medical information online, and it is very confusing, even for people with health degrees. You're like, what are you talking about? So I want to tease through all of it and give you facts so that you can then go have a meaningful conversation with your doctor or your healthcare provider. I'm not trying to sell you anything. I don't have any ulterior motives. I just want you to have the correct information. A bonus is maybe some doctors listen as well, and I can offer some different insights. I mean, the truth is we didn't learn everything in medical school. I mean, some of the stuff that is floating around on the internet actually is legit. Some of it, maybe it's in the middle. Some, absolutely not. But getting someone else's perspective may be helpful. All right, that was actually the short version. Maybe it wasn't that short. The long version is really not that much longer. It's just a little bit more detailed. So this is the long version for you detail-loving people. All right, people actually call me Dr. AK, and so here's the reason why. My first year as an attending, the intern class nicknamed me AK-47. You can go ahead and assume reasons as to why. I'll keep it a mystery. But that turned into my colleagues calling me AK, and then it turned into patients calling me Dr. AK. So you don't need to say Annahieta Kalantari. You can say Dr. AK. Much easier. Now, I spent the last 15 years of my career in academic emergency medicine, and I climbed the ladder and I did all the things. I ultimately became the vice chair of education of an emergency department. I got to associate professor level and was just about to get promoted to professor level. And then I kind of shifted my career more towards lifestyle medicine. I noticed in the emergency department that, people are coming in all the time with broken bones and cuts and different things that you need acute care in a timely fashion. But there were a lot of people coming in with chronic disease, exacerbations of their chronic disease repeatedly. And I'm like, I feel like I can do something to help on the other end of the door to the emergency department. And so that's what led me to lifestyle medicine. I opened my own practice, and I've had my practice for about a year now. It's going well. And a lot of times patients ask me questions about these different things they read on the internet. And it's not just patients, friends and family ask me as well. So I started writing a blog to address all of this information. Well, then I learned that people don't like to read. Not all of you. Some of you are avid readers, but a lot of you are more into this podcasting form of receiving information. And it just so happens, I happen to have all this podcasting equipment because I used to do emergency medicine education podcasts. So I thought, let's do one about medicine, medical information. Let's talk about health trends, maybe bust some medical myths that are out there. And that's it. That is my story. That is how we got to this podcast. That is what it is about. And that, my friends, hopefully jives with you and you will listen. Have a great day and stay healthy, everyone. While I am a doctor, I'm not your doctor. And listening to this podcast does not establish a doctor-patient relationship. This information is intended for general educational purposes only and should not be taken as personalized medical advice. Always speak with your own doctor or healthcare provider before making any decisions about your health.